Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and joining me today for our Healthline conversation is Dr. James Barnes, bariatric surgeon with Highland Clinic. Thanks for being here.
Thanks, Courtney.
Absolutely. Okay, so you are expert in all things weight loss, specifically bariatric surgeon, but you're also, weight loss injections. This is a really hotly debated topic, or just hot topic nowadays. So tell me a little bit about what you do in your practice.
Yeah, so we kind of focus, like you said, on all aspects of weight loss, and I think that's one of the unique things about our program is that we hit, and when you get into the obese and especially morbidly obese range, it's really hard to lose weight and keep that weight off without help, and that help for the most part comes in two big categories. One's the medical side of weight loss, whether it's the oral medicines that help with appetite, or more effectively is the weekly injections that we've all heard so much about lately now, the Ozempic and Mounjaro and Wegovy. And then the other side of that is the surgical side of weight loss. And so it's hard for people, there's pros and cons to both of those options, and it can be kind of confusing and complicated to help, to figure out what's going to be the best route to go. How do I know what to do? And that's where I think we can really step in and help people out with that, because we offer all of that. And so we're not going to try to, push somebody into one direction or another, because that's all we do. We do everything. And so, I really, take it as, sort of my responsibility to help people figure out what's going to be the best fit for them.
Yeah, absolutely. And you mentioned, you're not pushing one specific thing, so you're really able to sit down with the patient, figure out what best meets their needs. And maybe someone qualifies for the surgery, but they're not ready for the surgery. Just maybe it's a nerve-wracking experience.
And if we look at kind of pros and cons, and there's a lot of things to look at here. Part of it is based on your weight or your body mass index, because you have to have a BMI of a certain level to qualify for both the injections. You have to have a BMI of 27 or greater, or for the surgery, you have to have a BMI of 35 or greater. And so to qualify, you have to first meet the weight criteria. But then once you get to that, it's still, especially if your BMI is 35 and above, you could be a candidate for either option. And so, we help people understand pros and cons. The injections are nice because it's not surgery. It's a little bit of a lesser step where you're not committing to a bigger operation. There's always some small risks that go along with surgery. There's a recovery period afterwards, all of that. Advantage of the surgery is we do usually see a little more weight loss with that than we do with the injections, actually about twice as much. Also, for most people, it's going to be a long-term weight loss, and I think we'll talk about that here in a little bit too. But with the injections, they only last as long as you're doing them, and then when you stop them, there can be some weight regain with that. There's cost issues. The injections are expensive. They're not usually covered by insurance. We do a cash pay program at our office with the compounded version, which does cut the cost down significantly, but they're still not cheap. Surgery most of the time is covered by insurance, which is great, and a lot of people don't realize that, but most of the time people are going to have insurance coverage for that. There are side effects with the shots. There's side effects with surgery too, and so we kind of go into all that information. There's availability issues sometimes with the injections, especially with the brand name ones. People have trouble finding those sometimes because there is a shortage with that. So, there's a lot to look at, a lot of pros and cons there, and it can be kind of intimidating, kind of confusing, and that's what we try to help people sort through.
Right, yeah, and I think that what's also important is, you being a medical doctor distributing these types of medications, like the weight loss injection specifically. Can you talk about maybe the difference between getting these medications from a provider versus maybe a Medi-Spa or some place that maybe doesn't have a provider on staff?
Yeah, and I think that's a benefit. I think there are, when you look at obesity, it affects a lot of health issues, and so it's not just a cosmetic, I want to get back in a size 6. It's not just that sort of thing. And so there are a lot of medical aspects, the comorbidities that go along with obesity, the high blood pressure and diabetes and things like that, helping to manage that. Also helping to manage the side effects that go along. Sometimes with the injections, people have issues with nausea, and we have to address that, and sometimes even treat that with medications. So there's, can be that issue as well.
Yeah. So it's definitely check your source and make sure that it's a reputable place that you're getting.
And it's also where people are getting the medications, because the brand name meds are difficult, especially if you don't have diabetes. It's hard. The insurance companies don't usually cover them. And even when they do, it's hard to get them. And so a lot of people have gone to the compounded version or the generic version, but that can mean a lot of different things. And you have to look at where that's coming from and where you're getting it. We do get all of our medications from a pharmacy in Austin, Texas, so it's all overseen by the FDA and the Texas Board of Pharmacy. I've had multiple conversations with the pharmacists down there. And so, this is, we've carefully vetted this out. This is a reputable company in the United States that's producing this stuff. And it's really convenient too, because the patients see me monthly initially, and then we send the prescription to the pharmacy, and then they direct mail it to the patient's house. It just shows up at your doorstep a couple days later with all the instructions, and so it's a pretty nice program.
Yeah, pretty easy. Yes. Well, if you're just joining us, we have those phone lines open right now. 318-219-4569 is the number to call. It's right there on your screen. And we're talking with Dr. James Barnes with the Highland Clinic. He's a bariatric surgeon, and we're talking also about medical versus surgical weight loss. So if you have any specific questions, maybe about weight loss injections or bariatric surgery, give us a call. That number is right there on your screen, and we'd be happy to, Dr. Barnes would be happy to answer your questions. So we're talking about the weight loss injections too, and this is, big topic in the last couple of years, but I think that maybe a misconception is that you've mentioned it earlier. Some people think like cosmetic use, like I want to get back into a size, whatever. But really, you need to treat it more like what it is. It's a medication, and it's something that you might need to be on for a long period of time, similar to if you were on like a hypertension medication.
Yeah. So, to answer part of your question, the cosmetics is part of it. I don't mean to say that's not an important part, because some people that is a big issue, and they want to get in a smaller, healthier size. They want to look better. They want to feel better about themselves, and those are all great reasons to look at this as well. There are also a lot of medical benefits to weight loss. Obesity, I think, in my opinion, is the single biggest risk factor there is to a person's health. It has so many medical issues that are caused or worsened by obesity, especially as we get older. And so it's definitely a health issue as well. And so you're right, this is a medication that you are taking to treat a medical issue, obesity. And so, one of the things, and I get asked this sometimes, patient, will come in and say, can I just take it for a few months and, lose 25 pounds, and then that's all I need to do. And the problem with this, and it's not just obesity medicine, but it's any medication. It works while you take it, but as soon as you get off of it, you lose the effect of it. And so what we have very quickly learned with the injections is that if people are on them for a while, lose some weight, and get down to whatever goal they want to, and then just stop them cold turkey, the vast majority of those people are going to gain their weight right back. And so, we try to look at the long game with this, and that's, I think, really critical. And so, the way I approach that on the injection side, now with the surgery side, it's a little bit different, because most people who have the surgery, that's going to be a long-term weight loss. They're going to keep that off long-term after the surgery. But with the injections, we have to look at it at sort of a different approach to the long-term. So one of the things I do initially with the patient is let's figure out a target weight, and I can give people sort of a realistic expectation of what I would expect them to lose with the injections, but everybody has their own goal in mind too, and some people want to lose more or than others, and so we figure out kind of a target weight that we want to get to, and then when we get folks down to that weight, and that typically can take anywhere from depending on what that number is, 6, 8, 10 months, something like that is pretty common. But then we have to figure out where we go from there, and so that's when we get into more of a maintenance type program. And I really encourage people to do that rather than just drop it, because they're just going to gain the weight back if they do. So that can be several different things. There's sort of three ways we approach that. Some people, we will continue the weekly injections but decrease the dose down significantly. Other people, we go to doing the shots every other week instead of every week. And that works well usually for the maintenance. And then I've got some people that we've actually switched over to an oral medication, something like a low dose of Adipex or phentermine, where we can, may not be as effective in losing the weight, but in terms of just maintaining that weight, a lot of times we can do it with that. And the advantage of that is it's going to be cheaper, it's easier, it's just it's a pill instead of a shot. So. And then we encourage people to keep, coming. We usually, when we get down to that stage, we see people every 3 months for a while, maybe even every 6 months after a while, but still do some sort of ongoing follow-up, because I think that's a big part of it too. We just, I think it's just human nature. We all do better when we're being watched a little bit. It just adds a little accountability to it. And by keeping people in the program and coming back every so often, knowing they're going to have to get on my scale when they come in and see me, I think it just keeps people focused on it a little better, and that's how we achieve some really nice long-term results.
And with surgery or the medication, how important still is lifestyle and diet changes when you're on these medications?
I mean, that's really what it all boils down to, honestly. I mean, if you want to bring it down to its simplest thing, it's about the number of calories that you take in per day. And now there are a lot of ways that we can modify that, and the shots, you're going to not be as hungry, you're going to eat less. The surgery, same thing, decreased appetite. You're also not going to be able to physically eat as much because your stomach is smaller. But it still boils down to calories, and if you figure out a way to get around these with calorie dense foods, then you can outsmart them. So it still does come down to lifestyle changes and making the right choice. But the medications and the surgery just make that a whole lot easier.
Yeah, kind of cut the food noise, as we say.
Exactly. Yeah.
Well, Travis, thanks for joining us. And what's your question? Still there, Travis? Oh, well, Travis, if you wanted to give us a call back, we are ready for your question. Or if you were just joining us, 318-219-4569. We're talking about medical and surgical weight loss options, and great time to talk about it in the new year as well, especially if you have some weight loss goals that you're wanting to tackle in 2025. And you bring up a good point about calories and calories in versus calories out. But what do you think about, like we have our metabolism, right? And when we decrease our calories for a certain period of time, maybe on the injections or the surgery, could that possibly decrease our metabolism, and what are ways to maybe preserve it?
I think it can a little bit, but honestly, I don't think there's a whole lot you can do to drastically change metabolism. I think, for the most part, it is what it is. It does, we know it slows down as we get older, and people realize that is, you can't eat like you could when you were a teenager. Anybody that's got teenagers, they can eat 6,000 calories a day and not gain a pound. And, as we get older, and that certainly does change. We see it in women when they go through menopause. I think that changes metabolism somewhat, and there's more of a tendency to gain some weight. But in terms of changing that, that's kind of hard to do. And if you watch late night TV, you see all these commercials about just take this pill and it'll rev up your metabolism. That doesn't really make a big difference. But so it still goes back to calories, but that number may change depending on your age and your metabolism. Some people, and genetics is also part of that too. Some people, and we all know people that could eat anything they want all day long and not gain a pound. Others are much more sensitive to that. So I think the genetics plays a component to it as well. Some of it is just finding what that calorie number is that you can take to either maintain weight or lose weight, whatever your goal is at that point, and figuring out what that number is, and then we can help keep you on track where you do take in that amount, whether that's dietary counseling, and we do a lot of that too. That's obviously a big part of this as well, helping people figure out maybe some healthier food choices, and we have those discussions all the time with patients in the office when they come in for their visits as well.
Awesome. Yeah, and you mentioned it might be something like a gimmick, like the metabolism boosting things. So another thing that we were talking about off air, but there's kind of a trend that I've seen where people, the headlines like take this supplement or eat this food, and it's like the natural Ozempic or the natural weight loss injection. The first one that comes to mind is like psyllium husk, which is like a additive that's really has really high in fiber.
Yeah.
But what are your thoughts on those types of things?
It's kind of like we've all been taught, if it sounds too good to be true, it probably is. And I think there can be some health benefits to some of that stuff. Certainly increasing fiber is good advice, all the way around. It helps with your bowels, it helps with, sometimes it helps you feel full more, and then you might eat a little bit less if you have increased your fiber, whether it's something like that or something like Metamucil or different ways you can do that. Again, I look at it with a very skeptical eye when I see commercials for the natural, Ozempic or what, it's just, most of the time, it's just somebody trying to sell you a product.
Right, because those medications, they work very specifically on the hormones and, our digestive tract, so it's kind of hard to mimic that.
It is, yeah. And the way the shots work, they kind of do two things. They decrease your appetite. They work on the hunger centers of your brain, to where you're just not as hungry. You mentioned a minute ago food noise, and I really like that description. I hear that sometimes, where you're not just like, all this, these little voices in your head, thinking about food all the time. And when you're on the injections or when you've had the surgery, patients tell me all the time that food noise, it just kind of goes away. I'm just not thinking about food all the time. So that's part of how the injections work and the surgery. And then the other thing the injections do is they slow the emptying of the food out of your stomach. You get a little bit of what we call gastroparesis, which means the stomach just doesn't empty as quickly. And so when you eat a lunch, it's going to stay in your stomach longer. So you're not looking for something else to eat an hour later because that food's probably still sitting in your stomach. It hasn't started working on through as quickly. So that's part of how that works as well. The other thing that unfortunately can cause, though, also is some degree of nausea sometimes, and that's far and away the most common side effect that we see with the injections. And when people come in, to start our program, we do talk a little bit about, what are the potential side effects with it. Most of them are kind of GI related. Most of them are fairly mild and not, a serious consequence. But nausea is far and away the biggest one we see. Most of the time, it's pretty mild. And maybe the day of the shot, people will have a little nausea. I occasionally have a patient that I have to put on nausea medicine to take from time to time when it gets bad. But most of the time it's mild. But 30 to 50% of people do have some degree of nausea with the injections.
Yeah. Okay. And you mentioned dietary counseling earlier, and we were talking off air as well. But binge eating disorders, or just maybe people that struggle with maybe overeating, how do you feel like the medications or surgery or weight loss injections can help someone like that, and of course with the addition of dietary counseling? Right,
yeah. So the binge eating, and there's lots of eating disorders, and that is certainly one of them. And sometimes we have several therapists here in town that we work with to help with some of that sometimes as well, because sometimes that can be a component to it as well. Food addiction is certainly a component to obesity for most people. With the binge eating, surgery really kind of cuts that down because it just physically doesn't allow you to do that. Your stomach after a gastric bypass is the size of a large egg, and so you can't fit a plate of food this big into an egg. So it just physically limits how much a person can take in. And the same thing with the sleeve gastrectomy. After that surgery, the stomach's about the size and shape of a small banana. So, there's just only so much room. With the injections, again, the two ways they work, your appetite's decreased, so you are going to be less likely to binge eat because of that. And kind of the same thing, the stomach when without the medicines, when you eat a meal, the stomach starts emptying almost immediately as you start to eat. Well, with the injections, it's not going to empty as quickly, so again, it's going to fill up a little faster too.
Okay, so both of these topics are, very huge. We talk about them a lot, but what do you feel like is the future of maybe weight loss injections or surgery, or do you feel like we're good where we're at right now, or do you feel like what is the future advancements for both of these topics?
Yeah, so it's interesting. Obviously, we don't know exactly what's coming down the pike with all this stuff. With the medications, I think they will be fine-tuned more. I think they're working on medications that will decrease the appetite like the ones we have now, but maybe not cause the nausea. That's one of the things that I think is probably coming down the road. So I think that the medicines are here to stay, and for good reason for the most part. I mean, we see really good stuff with these, and so I think people are going to, the mix of surgery and medicine is what's still kind of sorting out right now. I think that there are some issues with the medications, and I think we're going to see we've seen a pretty big swing to the medications a lot now. I think that's going to swing back more to some degree towards surgery over time, because people find that the medications, they get expensive. It's hard for some people to stay on that long term. It gets pricey. Availability is still an issue with those. Now that hopefully will change over time as production increases. I don't know. It remains to be seen. But I think just being open to that, what I said earlier, it's not an either-or thing, and a lot of times it really is a combination of both. Losing some weight with the shots, so you're a better candidate for the surgery. Maybe somebody that's had the surgery years ago and has gained some weight back, which fortunately most don't, but some do. It's not 100%. And I've got patients like that we've then gone to the injections to help with, or sometimes we'll use the Adipex pills for that as well. So I think it's just being open to, and I was guilty of this at first. I'm a bariatric surgeon by, that's my training for the most part, but I realized years ago that that you've got to look at all the options, because it's not a single solution for every patient, and you've got to really talk to the patient, see what their goals are, see what their issues are, and figure out what combination of all this stuff is going to make the most sense for them and get them the best results. Absolutely,
yeah. And so, other thing to point out with the weight loss injections, some people react differently to them. Sometimes they may see really great weight loss, sometimes they may not. And so, how do you maybe talk to your patients about that, and then maybe let them know, okay, yeah, but you still have the surgery as an option as well.
Right. Yeah. And you're right. We do see. I'll see people that come in and just do fantastic with the injections. They'll lose, 5, 6, 8 pounds a month. They're just clicking right along, do great. And then I've got. I saw a patient the other day who's on the maximum dose of the injections. It's just is not working. They just have not lost any weight. They're not feeling the satiety, the appetite suppression. They're just not feeling it. And so, everybody responds to medications differently. And so sometimes you may start down one path and realize, okay, well, maybe this is working great, we'll continue on, but maybe it's not working great, so what are the other options? We're not committed to that one path just because that's how we started the program out.
Yeah, that's really good to know, and it's good to know those expectations beforehand, so that, because I think you just hear about all the amazing results people are having with the injections, and you think, well, that's going to happen to me too, but you just never know.
Yeah, and that's why I think it's important for, especially early on. I like to see people once a month when we're doing the shots, because it just keeps people on track, keeps them focused. If they're not losing like we should, let's okay, why is that? Do we need to up the dose? Do we need to talk about maybe something you're eating or drinking that we need to tweak a little bit? Things like that, and so that's so important. And then on the surgery side, we see people usually several times before surgery, where they have a chance to think about questions, ask questions, so they really know what they're getting into. And then the same thing after the surgery. The aftercare is such a huge part of that. You know, you see people. You know, I've seen people that go down to Mexico to get their surgery done because they don't have insurance coverage or something, but then they're just, you know, they have their surgery and they're turned loose, and those folks just tend to not do as well.
Yeah.
You know, I think the aftercare program with the guidance on diet and keeping on track on weight loss, you know, that's where you really see some of these great long-term results that we usually see.
Right, yeah. Okay, so let's say somebody's watching right now and they're maybe on the fence about surgery or the injections, but we know that obesity or just metabolic syndrome is so layered. It's kind of you know, just one of those things that can be influenced by many different things. What would your advice be for someone at home maybe struggling to lose weight and maybe they're not ready for these things yet, but maybe they're on the fence?
Yeah, so certainly just do your research. You know, it's so easy now to get online and you know, read about all this stuff. We have some resources online. You know, our website for the Highland Clinic is highlandclinic.com, and you can go and click under providers, and I've got some information there under my name. I also have a Facebook page. It's just under my name, James Barnes, MD, and we do a lot of stuff on there. I do a little weekly video segment every Wednesday morning where we just talk about different aspects of obesity and weight loss. And so those are a couple of good resources. And then just call the office, and that's an easy way too. And if you want to just you know, if you want to call and make an appointment, it doesn't necessarily mean we're committing to anything. It's just some people just call and like, I want to sit down and talk with you and get more information about that. And that's, you know, that's great too, because people don't always know what they want to do. We offer a free seminar every Tuesday morning just to come get more information. That's geared more towards the surgery side, but we also talk about the injections there as well. And some people, you know, will just make an appointment to sit down and talk about all of that, and I'm happy to do that. And they can just call the office, and I'll just throw that number out there. It's 318-798-4433, and you can talk with Ashley and Taylor, and they can kind of get you, you know, set up for something where we can sit down and go over more information.
Absolutely, yeah. And so kind of full circle back, we were talking about, you know, calories at the beginning. A lot of times that's a big contributing factor to just increasing the BMI, right, and having a higher body weight. But what is something that maybe you would encourage someone to change now? Like if they could change one thing about their diet?
So 3 things I tell them.
Okay.
Avoid liquid calories, avoid fast food, and watch your snacking. Okay. Those are kind of the 3 broad, big areas that get people into trouble. So if you can do well with those 3 things, that's going to really help.
Yeah, yeah, and I think a lot of times we don't think about the liquid calories, you know, the added sugars and maybe just ultra-processed foods as well that would come in this form of snacking. They taste really good, and it's hard to stop because you have that food noise too. Yeah, good advice. Yeah. Awesome. Okay, so and you also do a free seminar every Tuesday?
Yeah, Tuesday morning, 8 o'clock, we do a seminar for and again, that's more towards the surgery side. But anybody that's interested in just getting a little information about that, it's usually about a 30-minute thing where we go over all the information about the weight loss surgery, and then I'll meet with each person individually afterwards, and then kind of come up with a plan. And if they want to start, you know, moving forward towards surgery, we'll start, you know, working towards that. Some people decide maybe that's not for them, and that's fine. And some people decide maybe not surgery, but maybe the injections, and we'll talk about that a little bit more. So again, it's confusing, it's complicated. It's obesity is a difficult disease with a lot of different options. Yeah. Some of them are good, some of them are not. We talked about some of the stuff you see on TV that's maybe not such a good solution, and so you know, I try to just act as a guide to help people navigate through all that and help them figure out what's going to be the best thing to get them to lose the weight, get healthier. Getting healthy is such a big part of weight loss as well. Yeah, and if we have the seminar, we have your Facebook page, we have multiple ways to get in touch with you. Give us your phone number one more time. Sure, it's 318-798-4433. We have a small office. You're going to talk to either Ashley or Taylor when you call. We try not to have any sort of recordings or anything, so you're going to call, you're going to talk to a human, and they will help get you where you need to be. They can help verify your insurance to see what sort of coverage you have for these sorts of things. So they'll kind of be the first contact person to help get you where you need to be.
All right, good deal. Well, thanks, Dr. Barnes, for your time, for joining us, and all this great information. And if you missed this conversation, or if you wanted to rewatch it, it'll be on our website at ktbs.com/podcast. Thanks for joining us.